One thing researchers know for sure about long COVID is that it's still not well understood. Long COVID is a broad term that captures the many symptoms that can show up months and even years after testing positive for COVID. It can look like chronic pain, shortness of breath, fatigue, and even deteriorating mental health. This summer, the U.S. Department of Health and Human Services released a new advisory on how doctors can best identify and manage mental health symptoms of long COVID.
People with long COVID need help now. We have been working hard to really identify how best to help people who have these problems.
Public health analyst Molly Sanborn works for the Substance Abuse and Mental Health Services Administration, or SAMHSA, the government agency that put the report together.
We are really focused on continuing to prioritize the identification and treatment of people who have long COVID, particularly who are dealing with these mental and behavioral health symptoms, because they can be very debilitating.
Long COVID and mental health are basically very much intersecting problems.
Dr. Serena Spudic is a neurologist at the Yale School of Medicine. The new guidance brings together research from the beginning of the COVID pandemic to now.
A lot of patients have been experiencing things that they didn't understand, and a lot of times their providers didn't understand. So I think these guidelines are very helpful because they sort of validate and create categories for these conditions, and then they provide some kinds of guidance about how to manage them.
Research shows that long COVID can exacerbate and sometimes even create mental health issues like depression, anxiety, fatigue, and obsessive compulsive disorder. The U.S. government has 72 ongoing studies looking into long COVID, but Dr. Spudic says that more research and more funding for that research is necessary in order to best treat patients.
We really need to work together as a community, a research community, a funding community, a patient community, to get into studies and clinical trials so that we can understand these conditions and then come up with the best treatments.
Spudic says long COVID patients have also been pushing for more recognition.
There have been some major patient-led initiatives, both research initiatives as well as kind of government advocacy initiatives. Unfortunately, that's being really recognized by funding agencies.
According to the advisory, people of color, women, and people who experienced more severe symptoms of COVID are more likely to suffer from mental health-related long COVID symptoms.
There are populations of people who have been at particular risk of acquiring COVID due to their jobs or their social situations or their living situations that may actually also be at increased risk of having some of these mental health complications. So we need to make sure that those people can access medical care and that these conditions are screened for in them so that they're not even further marginalized and have more problems related to the fact that they're having these conditions.
Vaccination status also seems to be a factor.
Anyone who gets COVID-19 can get long COVID. However, the people who do appear to be more vulnerable for getting long COVID are people who have not been vaccinated.
But Spudic says connecting mental health to long COVID is not straightforward, and that's in part because of the widespread impact the pandemic had on our lives.
One of the big mysteries is how we can untangle how this is due directly to getting COVID itself and how much of it could be due to other factors that have affected individuals during this time period. Not only did people have COVID, but they also lived through a time that was unlike any other that any of us have lived through, and caused a lot of problems: social isolation, people losing jobs, terrible stress, people losing loved ones.
Spudic and Sanborn both say that getting help for mental health conditions is always a good idea, no matter what caused it. And this guidance is meant to help make that easier.
The focus should really be on primary care physicians being able to identify the people who do have these behavioral health symptoms and conditions and being able to refer them to treatment so that we can really help people experience a better quality of life.
One of the things that's really important about these new guidelines that have been released is to help to validate these conditions, to help to give them a category that will be recognized by insurance agencies, by the government, by providers, to help make sure that tests and implementation and treatments that are given to people in the context of these long COVID conditions, that they will be reimbursed and they'll be paid for. So if people are starting to feel a little bit more worried or anxious than before, trying to address that very early might potentially prevent that from spiraling into something much more devastating.
For people experiencing long COVID-related mental health symptoms, Sanborn says SAMHSA's findsupport.gov website can help. For the PBS NewsHour, I'm Nicole Ellis.